I'm going to be doing vital signs today. For this particular assignment, I'm going to need a pulse oximeter, a blood pressure cuff, a thermometer, a stethoscope. I have my chart here and a second hand watch so that way I can count the patient's heart rate and respirations. So I just reviewed the patient's chart, and I'm just going in to just assess his vitals. Hello, Mr. Clark. I'm Angela with Respiratory. I'm going to go ahead and wash my hands before we get started. I'm going to do about 3 milliliters of hand sanitizer. I want to, consistently rub it in for about 15 seconds until your hands are nice and dry. And always put on our gloves before we touch the patient. Hi, Mr. Clark. I'm Angela from Respiratory. Can I verify your name and date of birth for me? That looks about right. Okay, Mr. Clark, I'm here to do your vital signs today. The first thing we're going to do is I'm going to take your pulse ox, where I'm going to measure the oxygen. I'm going to put it on his left index finger. Okay, looks good. You are at 98%, very good. The normal range for that ranges between 95 to 100. It also depends on the device you use. So we're good with that. I'm also going to go ahead and take your pulse. What we like to do is use our index and middle finger to take the pulse, not the thumb, because our thumb has a pulse on itself, so you don't want to mix the two, so that way we get a proper reading of the patient. And I'll go on to the radial side of the patient's arm, and I'll sit here and I'll count for 60 seconds. You want to do a full minute because you get an accuracy. So while I'm doing this for 60 seconds, after I'm done counting his pulse rate, I'm going to kind of stare at his chest kind of from the side, watch it rise up and down, and for a full minute I'm going to count his respirations in that manner. Now that they're both been counted, so your respirations look really good. You're about your respirations are 16 and your heart rate is at 78. Normal range for a patient's heart rate ranges from 60 to 80, and then his respirations, good respirations would be between 12 and 20. All right, I'm going to go ahead and take your temperature. Could you put this under your tongue, please, and go ahead and close your mouth? Very good. 98.1, very good. So your normal temperature ranges from 97.8 to 99. And the last thing we're going to do, sir, is I'm going to go ahead and get your blood pressure. We like to put the cuff on not too snug, but not to the point where it's going to keep slipping off, and where I can read the dial. I'm going to place my stethoscope on his bronchial area, and then I'm going to pump it up to about 180. And then when I do, I'll release the dial slowly so I can get an accurate reading of his pulse, or his blood pressure, sorry. So I just took his blood pressure, and his normal ranges for your blood pressure is about 120/80. So I'm gonna go ahead and step out, Mr. Clark. It was nice meeting you, and we will come back around on you in a little bit. I'm gonna go ahead and take off my gloves. Dispose. 3 milliliters of hand sanitizer. Rub it in pretty good. Get it all nice and sanitized. All right, so after I stepped out, I went ahead and charted Mr. Clark's vital signs. I went ahead and informed the nurse about everything and how he looks and his assessment I did on him. For vital signs, your potential causes of a patient's values would differential, like reasons we do this is to make sure, like if his blood pressure's up or if his respirations are up or if he has a temperature, those are like indications of whether if they're experiencing pain or if there's like an infection inside their body. They're in respiratory distress, you know, if they just can't seem to breathe well. Those are the reasons why it's important to do vital signs and why we need to know these values and the ranges and where they're supposed to be. So I'm Angela. Thank you.